Here are some notes on mitral valve stenosis in adults. In other words, this is non-congenital mitral stenosis. You can see a picture of a mitral valve here that has become stenotic, and the narrowing, or the opening is very narrow in this case. The etiology is in the vast majority of cases due to rheumatic heart disease. In other cases, it might be due to calcification, sometimes induced by radiation. The signs and symptoms of mitral stenosis include exertional dyspnea, orthopnea, PND, or paroxysmal nocturnal dyspnea, and hemoptysis. And of course, because the mitral valve can back up blood into the right side of the heart, you can also have symptoms of right-sided heart failure as well as pulmonary edema, which is just behind the left heart. This right heart failure can also lead to lower extremity edema as well. In severe cases, you could have kind of swelling or enlargement of the atria, which can cause atrial fibrillation, and that can increase your risk for systemic embolization, potentially leading to stroke. The diagnosis is typically made partially clinically. You'll hear an opening snap with the middiastolic rumble at the apex of the heart, and on echocardiography, you'll have your definitive diagnosis, and you'll see increased transmitral flow velocity through a small, narrowed valve. The treatment is just percutaneous valvuloplasty. This is actually a pretty big procedure. You go in through the vasculature and you open up that valve. In more severe cases, you'll kind of do an open repair or a replacement of the valve next.